I get this question a lot, and this is a great question. So let me answer it for you. This is correct. If the patient is not stable, um, the nurse should be the one assessing the patient, including taking vitals, right? But here's where I think you guys get confused as students. Remember, they're sick, so they're going to be on a floor on a unit. So, for example, if the patient's in the ICU, they're in critical condition, right? So they wouldn't be considered to be stable, but they're in the ICU, and so you're going to have UAPs in the ICU. So I want to help you think about it differently. When we say unstable, so for example, patient's condition has declined, we're rushing that patient to surgery, or we're rushing that patient to another floor. That patient is not stable to be on your floor. So while we're taking that patient somewhere else because they are not stable enough for your floor and they need to be assessed, or right before they leave, they need to be assessed, you, the nurse, you're going to do it because they were not even stable enough to stay on your floor. Do you see what I'm saying? But if the patient just came from surgery, they're new to your floor, you need to make sure that they're stable to be on your floor. So you are going to do that first set of vitals. And if they're okay, then you can delegate that to your unlicensed assistive personnel. But if something changes, their condition has declined, they're no longer stable to be on your floor, guess what? Yeah, you got to go back. You got to do that assessment. You got to do those vitals. Because at the end of the day, if they're on your floor, if they're in the facility, well, they're really not stable, but they're stable enough to be on your unit. So that's what it's meant when the patient's not stable. So I want you to think about it in this way. If that patient's in your unit, there's nothing critically going on with them. Their status hasn't dramatically changed. They've just, they're on the unit. You're doing your vitals every 2 hours as they're supposed to be done. You can delegate it to the UAP unless there's an extenuating circumstance, like I mentioned before. I hope that kind of clears it up for you.